and welcome to Healthwire Media. I'm Sneha Kumari with you, and you're watching our weekly interactive session. And today's topic of discussion is the future of radiation oncology. For this, we have a very special guest who have joined us to share her insights on this topic, Dr. Tejinder Kataria, the Chairperson of Radiation Oncology, Cancer Institute of Medanta, Gurgaon. Welcome to Healthwire Media, ma'am.
Thank you.
And today we are going to talk about the future of radiation oncology. So, शुरुआत करते हैं question से. The first question which I would like to ask you is that why radiation oncology is important? I mean, what people should know about it?
That's a very good question, Sneha. The importance of radiation oncology is that it is a targeted treatment. It is a focused and targeted treatment which destroys the DNA. Yeah. That is the genetic code of the cancer. And it's a selective destructive agent which does not harm the normal tissues. Okay. However, since the tumor is sitting within the normal tissues, so the algorithms and the computer programming and the technology is there now, whereby we can protect the normal tissues and only focus and target the tumor. So it's a very, very selective targeted radiation. Okay. And it is one of the keystones or the pillars of cancer treatment today.
Okay. Ma'am, other than that, what are the different types of radiation oncology which or therapy which people should know? Because this is a very common question which normally people ask. So what are the different types of radiation therapy and how effective are those type of therapies? How much effective?
Well, all types of radiotherapy, if given properly, are highly effective. So you need to be careful when you select a patient for radiotherapy. Okay. And it's a localized treatment which is given to a patient. So you need to be very, very highly selective about it. Okay. And the types of radiotherapy are two main categories, which is the external beam or the teletherapy, and then the brachytherapy. In the tele, it's like you are working with me right now through a distance, remotely, through a telelink. Mm-hmm. So similarly, in the teletherapy, the machine is away from the patient and the beam is focused onto the patient. Okay. But in brachytherapy, it is close. So either we keep the radiation source within the patient or in the tumor or around the tumor. So these are the two main modalities. But now with the external beam radiation, it's not just open beams. Like I spoke to you a little while earlier, there are focused treatments in which we have stereotactic radiosurgery, in which a single dose of radiation is given without opening the patient, without giving anesthesia. Okay. So that is a very, very high dose that is given. And then we have volumetric modulated arc therapy, where the radiation goes around the patient in 360 degrees and it's modulated at every degree of motion. And you can also vary the dose rate. Then we have the IMRT, that is intensity modulated radiation. And then also there is image guidance. So these are the main common treatments which are available. And now we also have something known as particle therapy, high intensity focused radiation, which is coming from particle therapy like protons and carbon therapy. And besides that, then there are other modalities which we'll discuss what is the future about it.
Okay, ma'am. So talking about the future of radiotherapy. So can we know something about it? What is the future of radiation oncology?
Right. So as you know, radiation is the focused treatment which is done with the X-rays, and oncology is the study of cancer. But in the last 2 decades, radiation oncology or the radiation therapy has been used also for non-cancer tumors. And that is where a lot of work has been done. And it's used now for benign or non-cancerous tumors, especially when they are close to the brain, eyes, or the spinal cord. And in that, there are future developments which are happening, especially where you do not need large bunkers. So that's known as ZAP radiotherapy, where the patient can walk in like a vault. So you go into a room, you take the radiation and you walk out. So that's one. And then there is flash radiotherapy, which is right now into the clinical trials, into the preliminary laboratory work, where a very high dose radiation is given, more than what we give in a week. And that's given in with a few seconds. And that spares the normal tissues and also kills not only the DNA of the cell, which is duplicating, but the cells which are quiescent or the ones which are low in oxygen and sleeping.
Okay.
So that is where radiation is working. And the third frontier is that the immunotherapy, the immune response, that is the body's own tumor is uncovered because body doesn't know the cancer is there.
Yes,
and that is why it continues to grow. So when radiation breaks these cancer cells, they are picked up by the immune system and our body starts making an antibody, or the cancer cells are killed by the body.
Okay.
And that effect is now being joined, enhanced with the immunotherapy. So that is a very, forthcoming field, and we are having a lot of trials which are happening. So we are very excited about it, that you can give a single dose of radiation and then the patient can go on immunotherapy and you can cure these cancers.
Okay. So, ma'am, talking about the good part about it, but we'll also come to the, how safe it is for the patients and their families, and what are the side effects which we know about it?
That again is a very good question, because people have a lot of, misconceptions or fear about radiation.
Yes.
So radiation, as I said, is very, very safe. One, it is given remotely.
Okay.
Even the brachytherapy, we place the dummy applicators inside the patient, and it's a remote control treatment which has been there since the 80s, ever since I joined the subject.
Okay.
So we do not handle the radiation, and even our nurses or the staff, they do not get exposed to radiation. So it's remote. It's even safer than doing a CT scan or a simple X-ray. And the teletherapy machines are housed in big bunkers, which are reinforced concrete, and we are outside. It's like a maze. I would invite you to come down and see them, and you see how safe it is. And the patient's family doesn't stay inside. There's nobody who stays inside at the time of radiation. And the patient's tumor gets affected with the radiation, but the patient is not radioactive. So radiation stays, it's only switched on when we push the button. Like when you have a torchlight in your hand, and if you press the button, then only the torch is on. When you switch it off, the light is not there. So that is how we work with the radiation now. And secondly, we do something known as, like I said, intensity modulation or volumetric modulated arc. So it's an inverse planning. We do a CT scan. On that, we plan out where the radiation has to go, where it has to protect the normal tissues. So the patient's normal tissues are also spared. So nowadays, with the particle therapy, we call it radiation without tears, especially for children. So that they don't get the delayed side effects also. Of course, there are some side effects which were very high earlier on. Now they are reduced, especially in the patients who get the treatment in the oral cavity or in the larynx, because the area which is having the cancer or the cancer cells is very close to the normal tissue. So a patient has to eat by mouth. Then they get limited on that. So then we manage them with the supportive treatment. So it's safe for the patient and safe for the family also.
Okay, ma'am. Other than that, during the last question which I like to put is that to be very relevant during this time of COVID. So during COVID period, how you are working with this, or how much safety measures are you taking, or what are the things the patients or the family should know that we are safe while we are going for this during this time?
It's been a challenging period for us as well as for the families. And we know that the cancer is not something which is going to go away. COVID can be managed, but the cancer will continue to grow if we don't treat. So we've set in a lot of protocols for the safety of the patients and their attendants. So first and foremost is that we do not allow crowding. We request the patient to only come with one attendant, and then maintain 6 feet distance within the department while they are coming for their treatment and the planning. We request the staff, they always wear 2 masks, double mask is there. They wear a visor or a shield, and they wear gloves when they're handling the patients. And then they maintain the distance. And in between the patients, their accessories and the machine parts and the couch is cleaned with the protective agents, and the sanitization is done. So when we were taking 15 minutes earlier for a patient to go in and take the treatment and come out, that's extended to 25 minutes. So we've had to extend our treatment time per day, and the staff has been very, very cooperative. And at the end of the day, after the treatments are over, we have UVC filters with which we sanitize the whole bunker. All the bunkers are sterilized every day. And also then what we do is that we work very closely with our fire team and our safety team and open the fire exits to have the normal air ventilate through the department, because we are a completely air-conditioned department.
Right.
So we are taking all these measures so that even if by chance a patient who's tested positive or who's carrying the infection but has not yet tested positive and has visited the department, so that the infection doesn't get carried over to the other staff members or to the patients or the attendants who are visiting there. And similarly, the nursing staff is very careful. Then we've segregated the cafeterias where we have the patient, when the people go and have their food, or the staff goes and have their food and the drinks, when they are without the mask, they maintain a 6 feet distance. So all those measures are in place, and that's how we've been able to take our patients through treatment in the COVID times.
Okay.
And going forward, it's not going to get easy.
Right. Definitely. That is a very difficult time we are going through. So ma'am, I think the important parts we have covered in this interaction. Other than that, do you want to add anything else from your side?
I think I would just like you to, Sneha, give a message to the audience or to the public that radiation is a safe treatment. It is one of the keystones of cancer treatment. And when the patients who receive it, 80% of them cure. In early stages of cancer, especially for cancer cervix, that is the mouth of the uterus, for the larynx cancer, for the breast cancer, radiation not only adds to the local control, it cures these patients to the tune of 90%. So patients should not forego such an important treatment. So that is my message to you. And also, I would like the people to be safe, maintain their hand hygiene, keep their mask, and the social distance when they come to us for treatment.
Right. Okay. Thank you so much, ma'am, for joining us and giving us your time and talking about radio oncology, which is, which is very safe. People can go for it during this time also. So thank you so much for joining us.